All right, welcome to this special First Stage Investor King's Crowd webinar. Easy for me to say. I'm Vin Narayanan. We've got a special one today. We're talking with the founder of Illusio, which is a startup, an interesting startup that we recommended here at First Stage Investor, and that King's Crowd also rated as a very good deal as well. Joining me to question Ethan Winter, the founder of Illusio, are my compatriots at arm, Chris Lustrino from King's Crowd and Andy Gordon from First Stage Investor. So welcome to the webinar, and gentlemen, let's kick this off. And let's start with a really basic question, Ethan, which is, tell us a little bit about Illusio and what it is that you're doing and what no other company's doing out there.
Yeah, I appreciate it. I appreciate the invite to be here, Chris, and the recommendation, Andy and Vin. It's been a fun journey so far. A number of years developing this technology that we have, which is basically a visualization platform for plastic surgeons. So what Illusio basically is a tool that enables a visual discussion, or I like to say a visual experience between a plastic surgeon and a patient. And what it basically does is it takes a 3D scan of a woman who's interested in breast augmentation. So our platform is intended to be utilized for all types of aesthetic or plastic surgery. Our first iteration is for breast augmentation. So specifically, women typically go in to see a plastic surgeon. The first time is a consult, which is basically an interview process or a meeting. The surgeon's trying to sell his or her practice on the patient, and the patient's trying to find the best surgeon to choose from, because there are, of course, many. And an average woman sees about on average, a woman visits 3 or 4 surgeons before picking one. And when they meet these surgeons, there isn't a whole lot of things that differentiate one surgeon from another. And in terms of their expertise, they usually use a before and after book, a gallery, going through and envisioning what they see in the book of gallery for the after effects. How suitable is that for each patient? That's how they determine what they're going to look like, which seems really foolish given all the different technology today, even something as simple as Snapchat. You can throw different stuff on your face. So we developed a tool where a woman can have her breast scan. We can superimpose that back on her body using augmented reality, very much like Snapchat. But once you do that, the surgeon can manipulate that form, change the shape and size, basically to have a real-time discussion with the patient. So now they're both visualizing exactly what the surgeon has in their head, and the patient can react accordingly. And they can make minute changes until they find something that both of them think is the best result for that patient. It's a long-winded version of what we are, but that's the tool. There's nothing else out there like it. And if you ask every woman in the world who's going to go in to have this procedure, they'd want it, because why wouldn't you want to see what you're going to look like?
All right, so let's dig into that a little more, because I think the analogy you're saying right now is that when a person goes into a plastic surgeon right now and is trying to figure out what they're going to look like after breast surgery, you're saying they're basically flipping through Polaroids and then trying to imagine what that or pictures, and saying it's almost like going through mugshots. It's like, all right, am I going to look like this? Am I going to look like this? Right. And that sort of thing. And what you're doing is you're using augmented reality, where they can see themselves, and you can adjust the breasts on that projection of themselves, so they have a much better idea of what they're going to look like after the surgery is done.
Right. I mean, they're looking in a virtual mirror. So basically, they're standing in a doctor's office. They're staring into a TV that's mounted on the wall like a mirror. They see themselves. They can turn side to side, but what they see on their body is a 3D rendering of their actual breast being transformed in real time to show what they'll look like. So it's like looking into the future.
That sounds fascinating. I'm just curious, what was the most difficult part of the product, of the technology, to develop?
Oh, Andy, the list is long. Honestly, it's the development of the technology is very, very challenging. Finding plastic surgeons to give you their insight is extremely challenging because they're so busy. And then finding a distribution partner that helps penetrate that market because, selling any kind of medical sales is extremely challenging and really expensive. So unless you have a partner that's going to give you entree and help with that distribution, it's a daunting task. So all of those things were really, really tough. And, but I'd say probably the technology is so much more difficult than it seems. It seems easy, but, and I'm not a developer. The number of developers that we've had to source to pull everything together has been long and complicated.
So Ethan, if you don't mind me taking a step back here, I would love to understand what brought you into this market. Why did you decide to try and solve this problem specifically?
That's a good question, Chris. I was introduced before this company to the concept of augmented reality through another business. And I love the idea of how do you bridge, the digital world and the real world. I mean, how many applications must there be and how many pragmatic applications, not just, advertising and, trying on clothes in a virtual mirror for, to sell consumer goods. So gimmicky games, consumer sales, and ads seem to be the only real applications for augmented reality. And I think that's probably true for virtual reality, especially 4 or 5 years ago. So I wanted to do something with that. At the same time, my wife, we just had our second child, and she wanted to have a mommy makeover. And my cousin is a cousin and a very good friend of mine, is a plastic surgeon. So he did the mommy makeover on my wife, and we just started, spinning the thought of what was missing in that process? And what if you could have seen what you were going to look like? Would you have made different decisions as to the type of implant and the size of implant? And resoundingly, the answer was yes with her. And then as we queued different friends, consistently with women, the answer is yes. I mean, almost 100%. And so, you go from that idea to, wow, that would be cool. Let's find some people who are much brighter than we are who can start developing and seeing if it works. So you start with a very early beta test, a very early version of something that now looks horrible. But back then, at least it was a representation of what the concept is. And you take it step by step.
And so it works. I mean, it seems at least for the patient, the benefits are pretty clear. But how about for the surgeon or doctor? What are their incentives to use your product, your technology?
So if we look at again, statistics that we understand from the industry, and there are some great reports that are public. You can go to the American Society of Aesthetic Plastic Surgery, ASAPS, ASAPS.org. They have terrific research on the industry. And what you'll see is that, again, women see 3 or 4 doctors. So if you reverse engineer that, right, that's about a 33 to a 25, or say 25, 33% conversion rate. So a doc's only closing 1 out of every 3 or 4 patients. They make, on average, just under $4,000 in the US per basic breast augmentation. So if we can increase that sales conversion from a doctor's perspective, they're making more money. They're closing more patients. So we're helping them to close patients, to convert the women, to educate the women as to what their expectations are. What we really want to do is make sure that the doctor and the patient share the same vision of what surgery is going to accomplish. If you don't have a visual aid to do that, and you have a doctor with one mind and one set of facts and a patient with another, no matter what the communication is, if it's solely verbal, there's a huge gap between what those two impressions are. And that gap leads to, on average, 1 out of every 5 patients having a reoperation in the near future after that first procedure. It's not all due to the wrong size, but a great portion of it is due to simply picking the wrong size implant. So we're trying to cut down on reoperation rates, increase conversion or sales from the doctor's perspective, and basically just make happier patients who are going to refer more business and not only refer others, but come back to that surgeon for other stuff.
So you sort of led us into the next question is how do you make money?
So we make money by licensing our software. It's a SaaS-based model, software as a service. We have a monthly licensing fee of $600. And if you put that into perspective, right, 600 times 12 is 3,600. Am I doing that right? Yes. 3,600. And if we're saying that a surgeon makes a little under 4,000 with one surgery, that's one extra patient a year, covers the cost of the software for that entire year. So that's the basic value proposition, which we think the bar is very low. I mean, from an investor's or business perspective, you think you should be charging much higher. Unfortunately, you still have to have market acceptance of whatever that rate is. The nice thing is at 600 a month, we do really well.
So what has been the feedback on the product to date?
It's been fantastic as a concept. We've iterated it a number of times, Chris. We've gone out there with a product, and the feedback is this is awesome. Can it do this? It's awesome with what you have. What if you also did X, Y, and Z? And that's what, for the past about 2.5 years, kept sending us back to the drawing board, because we didn't want to have a subpar application in the marketplace. We'd rather pull it back off the shelves, retool it, and then put it back out there. So we basically answered every concern in the marketplace. And the last challenge, which we're overcoming literally this week, we're in final quality assurance testing to release our final product. The biggest challenge has been capturing an actual 3D scan of a patient, superimposing her breast back on her, or a rendering of her breast, and then manipulating that 3D scan. So that took a lot. I mean, back to Andy's question, what was challenging? That has been really challenging. But we've done it, and we couldn't be more excited about it.
And this is a pretty big market, isn't it, Ethan? Could you tell us, some numbers here about the U.S. market? And I'm under the impression that the U.S. market could be bigger than other markets, but the global market is also shouldn't be discounted, should it?
The global is about 10 times what the U.S. is.
Wow.
Yeah, the U.S. is 7,000 plastic surgeons.
Yeah.
And plastic surgery has two different paths, I should say. You have aesthetic plastic surgery, which is all elective, like breast implants, and you have reconstructive plastic surgery. We want to sell to both. Our first product is really intended for aesthetics, but we plan in 2021 on making adjustments to it so it can be applied to a reconstructive surgery for cancer patients post mastectomy. There's a lot more entailed there, so there are some challenges, but we think we can have that out in the marketplace in 2021. In terms of pure numbers, there are about 7,200 board certified plastic surgeons in the United States. Now, that's board certified. Non-board certified physicians, so any other MD who doesn't do their fellowship and residency in plastics, can also perform breast augmentation. So that's another market. We choose typically not to target those surgeons because we think we're protecting our brand by really focusing on board certified breast docs. That's the objective in the U.S. Outside the U.S., it's a little bit more gray in terms of that differentiator between board certified and non-board certified. So you're talking about probably 70,000 to 100,000 practicing surgeons in total, in aggregate. And in terms of numbers, basic breast augmentation, and when I say basic, I mean that number, basic augmentation in the U.S. is about 320,000 basic breast dogs a year. In addition to that number, you have women who are having breast reduction, breast lifts, again, breast reconstruction. So different types of breast surgery, which is applicable in this visualization discussion. But the number we mostly talk about to investors is basic, primary, I mean the first time a woman gets it, breast augmentation, just because we narrow down the variables for the discussion.
So in the sale of your product, is there a device and then the software, or is it just software? And then the more important question from there is, how are you selling this? How are you getting this to market?
Yeah, good questions, both of them. So the first one, the device, our application lives on an iPad. All the data is stored in the cloud. So we work with AWS for cloud storage and transmission. So you just need an iPad Pro. We do recommend that the doctors now purchase a 3D camera that attaches to an iPad. It's a $500 camera made by Occipital. We use the structure sensor, which is now the structure Mark II. So a $500 attached camera to an iPad, and that's it. The other material is we need a tracking marker, because for augmented reality, the computer or the camera needs to know where to place a virtual image. So the woman wears a bandeau covering her breast, and there's a 4x6 marker that rests on that bandeau, which allows the camera to track. That we provide for free. As many as the surgeon needs, it's disposable, it's inexpensive. And that's it, very simple.
So it doesn't sound like you're going to have any supply chain problems.
No.
Yeah.
No, and the nice thing is, Andy, as the companies, principally as Apple iterates their iPad, we'll make improvements to the software and they get automatically pushed. So surgeons can either buy the new iPads and they'll have corresponding software that matches or not. And that's all included in the price, as it's a SaaS-based model. It includes all iterations. How do we get it to market? That's what I alluded to in one of the challenging components of building this company. We were lucky. We signed a strategic, I call it luck, maybe there was more, but we have a strategic partnership with the largest breast implant manufacturer and distributor in the world in Mentor. Mentor Implants is a Johnson & Johnson company. For us, it's a great partnership. They're about a 20-minute drive from our office to their headquarters, so we are there every week. It's a really tight partnership, which has been great for us, because we don't just rely on them as under the guidance of the current agreement, which says they will facilitate sales. In other words, their sales department will introduce us to the market, introduce us to surgeons, arrange virtual demos where we can talk about and show our product to the surgeons, and their sales staff will stay in the midst of that process all the way through. And there's a revenue share component to it, so it makes sense for everybody involved. But on top of that, we have developed what is called the Mentor Visualizer, powered by Illusio, which is on Mentor's website. So what they've done is they've built a platform to educate women all about breast implants. And they call it the patient journey, where a woman goes to Mentor, gets a teaser application to what visualization is, and then directs them into surgeons' offices who have this. The reason Mentor is doing all of this is they believe visualization should be part of the overall experience from a woman's perspective. It's going to answer more questions. It's going to give them a better idea of what they're getting. And basically more women are going to commit to surgery and they'll sell more implants, which is why they're doing it. They just think that our platform benefits their business. So it's a great relationship. That distribution pattern, by the way, is, using a workforce of 80 to 100 salespeople that they have here in the United States and outside the United States, working with their sales force when they sell in direct markets, and when they sell through third-party distributors, they arrange the same mechanism working with their distribution channels. So whether they sell direct or indirect, we intend to always be sold with Mentor.
Yeah, that leads us quite naturally into the next question, and thank you, Ethan, for providing us all of these smooth transitions. Is that, all right, you're working with Johnson & Johnson through Mentor. What's to stop Johnson & Johnson or Mentor from saying, hey, you want to know what? We can build a better version of this, a cheaper version of this, a faster version of this, and just keep the money for ourselves. What's to stop them from doing that and just cutting you out of the process altogether?
Now, the most difficult part about answering that question, Ben, is I don't know who at J&J is watching this webcast. I don't want to be critical of them.
Assume that the CEO is watching this podcast.
You're right.
And answer
Johnson
accordingly.
& Johnson is a great company. They're great at selling what they sell and doing what they do. They're not a development company, nor do they want to be. And I think they've tried it in the past and realized this isn't what we do. And I know because when we created the visualizer for their website, I mean, there were challenges, and we became very well aware of what their capabilities are and are not. So it just simply isn't in their wheelhouse to do this.
So when can you begin to and let me know if you've already done so, but when can you begin to really actually sell this, actually have this in the doctor's offices, have all of the approvals here in the United States?
Eminently, meaning probably if it wasn't for COVID-19, COVID has shut the doors on a lot of plastic surgeons because their elective surgery fell, but now all of that's resuming, and it's resuming really fast, faster than the general market. And many elective surgery is lifted, then plastic surgeons are operating all over. Even now, probably 30 or 40% of plastic surgeons in the US have their own operating rooms. So they have not been held back as much as those who operate in hospitals. Patients, from my understanding, have not slowed down. I mean, they have just been filling the pipe through this event. And I think doctors are beginning to operate, almost on a, feverish pitch of how many they're doing every week. So we're ready for that. We'll be out in the marketplace in about a week or two. We've been building the pipe, getting ready to fill that demand. So the demand has been outpacing supply from our perspective. COVID sort of gave us the opportunity to get the tech part ready so the supply and demand do meet. So I'd say 1 or 2 weeks in the US, and concurrently we're working on contracts overseas in the Middle East and in Europe on getting contracts with the mentor distributors in those areas, and everything's wrapping up there as well. And in fact, there was one more later, if I can just mention quickly. We're now working with some of the biggest J&J or mentor accounts on integrating our visualization platform into their virtual or remote consults, which are being done by the thousands right now in the largest clinics. When I say large clinics, I mean plastic surgery businesses that have many offices. And a lot of them now are turning to advertising on TV and generating that first meeting point or touch point through a virtual meeting or virtual consult. They're doing these sort of like this webinar right now, but they're doing it without visualization. So if we can integrate our visualization and have a woman in her home with the augmented reality component that we have, it just makes that a much more sort of end-to-end representation of what that consult is.
Yeah, to circle back to something Chris asked, do you need regulatory approval for any of this, or are you just sort of good to go?
That's a really good question. We don't. As long as it's elective and call it a cash-based service, there really isn't anything other than HIPAA. So we have to be HIPAA compliant. So everything that protects the patient's privacy, of course, we adhere to all of that. When we go into selling for reconstructive surgery or mastectomy, if we want to become a reimbursable expense, then yes, we're highly regulated and we'd have to go through the FDA. There is a possibility that we'll not go through that and have this as a free service for mastectomy patients, with the understanding for us that it's something that we just should do anyway, because it's, in my view, it's the right thing to do. From an investor's perspective, there will be a great deal of goodwill that will blend over to the aesthetic side of the business.
Ethan, do you mind if I go back to your relationship with Mentor? They, it's a huge organization. They must have sales objectives for 2020. Maybe it's changing all the time because of the impact of COVID-19. But if they have sales objectives, and they also have as part of their mission now to sell your product, do they have objectives for selling your product that gives you an idea of how much revenue, how much sales you could expect this year or going into next year? I know this is a moving target because everything is, is a little bit uncertain these days. But can you give us some expectation of how quickly you expect revenues to, to get a jump start as soon as you say in a couple of weeks?
Yeah, so we've already met with their sales divisions in the United States are broken into 7 divisions. We now have relationships with all 7 division managers. We're training their trainers to work with the whole network of salespeople. So the training mechanism is happening now, which is great. In terms of objectives or projections, let's talk about just objectives. What they want to do in year 1 of this contract is establish a baseline. So get all of their salespeople educated, refer as much business as possible, start selling the platform to doctors, and establish a baseline. And then look at it from an analytics perspective and look at how those surgeons or those practices are performing and selling mentor implants versus those that aren't. And now we establish a baseline in year 1, so year 2, let's go and build upon that and replicate what is working. So this year, they have 2 partners, us and then another company, which is a pharmaceutical company. In that partnership, they're in their 3rd year. So I'm able to see exactly how they've tracked that relationship. And it's very pragmatic. It's educate everybody, do all the right things in year 1 without being overly aggressive because they want to establish benchmarks. And now we have a goal to build upon that benchmark for year 2 and year 3. The nice thing about that, Andy, is they're not the kind of company that's going to say, if you don't hit the right matrix in year 1, we'll cancel the deal. That's just not how they play. They play long-term.
And long-term meaning more, I understand you have a 3-year understanding or collaboration agreement with them. So are you saying that if this works out for both parties, that agreement could and it would be expected to be extended?
Yes, absolutely.
Yeah.
I mean, I don't see any reason why it would. I mean, if the whole objective from both parties is to increase mentor implant sales. So if we can move the needle on mentor implants, then they are, why would they walk away from it, nor why would we? If we don't hit that, then, at our sales value proposition and with what we know about cueing or questioning women about having this in the consult, it just doesn't, it wouldn't equate that it doesn't get there. And by the way, when I mentioned we know women want it, we have done surveys, some market research on this. High 90%, 97, 98% of women, when shown our platform, say that they would absolutely want our visualization in a consult. And in fact, we tested, I think we found that 67 or 70% of women said, in fact, it's more, it's 87% of women who already had breast augmentation when they saw our platform, said they would have made different decisions. So, I mean, it's really impactful. So if we know that women want it, and now we know that we have a tool that doctors have asked for, and we have the right distribution channel, and we have a price point that's extremely low, it's just hard for me to think that it wouldn't get where Johnson & Johnson wants us to get, which is what we want. So everyone's happy.
What could go wrong? That's, I mean, you implicitly asked it. Let me explicitly ask it. What is there? I mean, there must be, things can always go wrong. This is the beauty of a startup, right? But is there anything that keeps you up at night?
That surgeons just don't get it. That maybe, it just takes some, all plastic surgeons don't have to be excited to buy our product, but some of them do, right? We need 10% of them to really embrace it the first time they see it. So, and they will. Now, whether they embrace it the first time they see it, or it takes them a week or a month or 3 months, that's what we're figuring out.
Okay.
But again, that value proposition is really attractive. Yeah. Once we get 7-8% penetration levels, then it becomes a must-have versus a nice-to-have, because it's a competitive market. And if Dr. Smith across the hall or down the street has Illusio, and the patients are shopping around and one has it and one doesn't, then all of a sudden it becomes this thing where, oh, how much is it? Okay, we better bring it in, because we can't be losing patients to Smith down the street because they're spending $600 a month and we're not.
So what, if you can, and if you can't, that's fine. But what does kind of the revenue share partnership agreement look like with the organization? And is this exclusive only to them for this product?
Now, I don't know if our CF has the share. I don't think it does. I'd rather not disclose that. It's pretty confidential, I think. But it's an attractive number. I mean, it's a gross sales revenue split. So again,
Gotcha.
Mentor is very incentivized to make this happen from that perspective, and the intent of it is to have it trickle down so that sales staff are incentivized as well. So there's a dual purpose for that revenue share. What was the second part of that, Chris?
No, you kind of hit on it. Oh, if it was exclusive.
Yeah, it's totally exclusive. I mean, in essence, we are a one customer company. We never have to hire a sales staff. Now you talk about what is cool for a startup, to never have to hire a sales staff.
Now, when you think about expansionary, if you don't mind me asking, if you think to go into other elective surgeries or reconstructive surgery, whatever it may be down the road, and I'm not talking just for, for breast cancer patients and things like that, but for other things as well.
Yeah.
Will there be exclusivities on that as well? Or because maybe they're not in that market, you can go and do a different sort of partnership?
Totally go off and do other partnerships. They're not, and they won't be getting in the way. I mean, I think Mentor will be in the partnership for any elective surgery performed by those customers, as they should. So if they're getting us into an office and that surgeon doesn't just do breast, they also do liposuction, abdominoplasty, nose jobs, well, they should get a cut. Sure. But they're not making components for, say, surgeons who specialize in nose reconstruction. It's a whole different, there's some overlap, but there's also a big chunk of that market that's not doing breast. They're not going to have an issue with us moving and finding another partner for that component. And it may be, as the company evolves, that we just split the two divisions up. One division which is true to anything around breast implants, and one division which goes elsewhere. Say cosmetic dentistry. That's another natural market for us, which is a market that's probably 10 times the size of breast augmentation. If we go into cosmetic dentistry, that has nothing to do with Mentor. But it has a lot to do with our technology. Because wouldn't it be great if you're looking to rebuild your mouth and you can look into a virtual mirror and as you speak, see your new teeth? We've had a lot of cosmetic dentists approach us and ask us, can we build it for them? We don't have the bandwidth right now, so we've never entertained it. But, there's no reason why we couldn't.
All right. So along the same themes is that the more successful you become, the more competition you attract. That's just sort of the way it works in the startup world, which means that the more successful Illusio becomes, the more likely startups are going to say, wait a minute, I can do that. And so what is it about the Illusio software, the Illusio suite of tools that puts you further ahead of these startups that are coming from scratch or maybe an alternate technology and say, all right, this is why you really want to stick with Illusio, and they're not necessarily going to be able to eat into your market share?
Right, that's a good question. And I think someone asked earlier, what keeps me up awake at night? I think it was Andy. That used to keep me awake at night. 2 years ago, I would have said, yeah, cold sweats at 3 a.m, waking up and realizing there's some competitor that just hit the market and is better than we are. I am not being arrogant when I say, since that time, I've realized this is tough. This is really tough stuff that we've developed. And again, I'm not taking credit. I'm not a developer, but the people I've gone to, I tip my hat to them. They're geniuses and they're amazing. And I see it every day. So I'm not worried from a technical perspective because it's so incredibly challenging to do this. But let's just say a startup had the wherewithal to create or copy. I mean, it's easier to copy than it is to create. So now they can copy us. But it takes time. You have to have a plastic surgeon, really involved in the process, because I'll tell you something, breasts aren't easy. They move in so many different ways. There are so many different types of breasts, and it's not just like a balloon where you blow it up and it gets bigger and smaller. I mean, it's much more complicated than that. So to address all of that is difficult. You need to have that expertise. And then you need to have, how are you going to take it to market? I mean, there are only 3 main FDA-approved implant companies in the United States: Allergan, Mentor, and a company called Sientra. Sientra has a very small market share. And then there's, basically Allergan and us. So you just don't have many distribution options. So you've got to have a partner. You have to have that wherewithal or expertise from the industry, and you have to be able to develop something. It's a rough.
Do you have patents in place that are protecting you as well?
We have 1 patent in place, Chris. We're seeking others. Software technology is tough to patent.
Sure.
So, in the beginning you file, you try to get something broad-based, and then as you develop, you try to chase down more narrow patents. But it all costs money. So as a young startup, it's tough in software. But as we get through these rounds of funding, that is one source or one use of funds.
Well,
All right.
that raises a good question. So let me ask you, I think from our discussion, you're not spending any money on a sales team. So you're raising on Equifund. And how do you plan to use the money that
we raise? First and foremost, I want to bring development in-house. All of our development has been outsourced other than our CTO, who guides everything and is very hands-on, but we're talking about probably 5 different coding languages. So it'd be great to start bringing these resources. I mean, better than great. It'd be incredible to bring those resources in-house, not only to have all of their time committed to Illusio, but to have to be able to control that product. It's really tough to control product quality. When you're working with independents who are, whether they're overseas or in the United States, it's all difficult to manage. So, that's number 1. And number 2, we're not selling, but we are training. So we need to build out a customer support and training staff, so that whether there's an office here in California where I am, or where you guys are back east, or in Romania, in Russia, in London, in the Middle East, wherever the offices are, we want to be able to train those offices to make sure they're using the product appropriately. We have a training center here in our California office. It's basically like a sound stage, where we have a doctor's office in a sound stage with fixed cameras, so we could train a staff, no matter where they are or what time it is, virtually, like we're having this webinar, on how to use Illusio properly.
So a few questions that have come in from the crowd. One question that came in is, if you're making $600 a month, which is the price of the product, then your total addressable market in the US is around 50 million, and worldwide 576 million. They went and did the math.
Okay, cool.
So how do you, the question here is, how do you plan to increase that total addressable market? And I know we hit on some of these elements, but would love to hear from you directly.
How do we increase total? Well, I think if we just get 10% of TAM, we're doing really well. So let's just, let's not think about blowing out total addressable market. Let's just think about if we can get 10% of that, that makes a really nice company, and everyone's happy. If you did want to blow out TAM, say you wanted to get Illusio to a point where the big venture capital firms are excited about a Series B and a C rounds, and really want to scale the company to become, a $1 billion plus company, which it wouldn't be in aesthetics, but we would certainly be in the hundreds of millions. If you wanted to cross that billion threshold, then you go to things like cosmetic dentistry, like I said. You're taking our core platform and saying, asking yourself, where else can we apply this technology? And what other partnerships do we need, like our partnership with Mentor, to make that viable?
Got it.
And I think all of that's doable. I'm just not, we're trying to stay laser focused on being the best in our given market, and then expand once we have some real success. It's a lot easier.
Makes total sense to me and is definitely the right way to go from my perspective. So one of the things I think in that's helpful in understanding the value proposition of what you've created here is understanding the current standard of care and what currently goes on in a consult before someone has a breast implant surgery.
What currently goes on from the patient's perspective, or what are the steps that typically happen before, from inception of the idea to under the knife?
So yeah, I would say from a patient's perspective, when they go in the door to have that consult, now, you have Illusio, they could visualize what it could look like to have these different breast implants. But right now, when they go into the office, what's occurring in place of that?
Right now, basically, like I was saying, women want to have an idea of what they're going to look like, and the way that they answer that question, what will I look like, is based on what other women look like. So before and after pictures of other women, they tear sheets from a magazine of a model or an actress and say, I want to look like that. And that's all fine and dandy. The problem is that women's anatomy is totally different from one to another. So, and this sets up the wrong expectations. That's why women come out of surgery thinking that they were going to look like that pinup model or that other patient. And they don't, not because the doctor did a bad job. They don't because their anatomy doesn't allow for that. So with Illusio, not only can they see what they're going to look like, we can also tool it, move the form around to show a patient what they can't look like, or what wouldn't be a good idea, but could be a result. For instance, if a woman has small breasts and a large gap, no cleavage, a lot of those women envision, volume added and cleavage added. But that's not something that is really possible, because you can't move breast tissue closer together. You can place the implants closer together to give some cleavage. As you do that, you rotate, I know this is a little graphic, I'm sorry, but you rotate the nipples outwards. So that's what happens to a lot of women when they go in saying, all I care about is volume and cleavage. And the doctors don't do a great job of explaining, if I do that, we're gonna rotate and it's just gonna look wall-eyed and weird. Why don't we not focus on cleavage and let's leave a gap in the middle and keep the implants positioned right to have your nipples pointing forward. Two different outcomes, two different discussions. If you can't visually see and compare one versus the other, you can, from that example, you can see what's missing. So
Makes
yeah,
sense.
I mean, they're looking at other people without Illusio.
This is sort of an out of the blue question here, but I'm thinking, is there any insurance policy implications here? I mean, if your technology makes a positive outcome much more likely in the possibility of being sued for malpractice or whatever, just because of expectation, just a miscommunication on expectations and everything. It seems to me that there might be a side benefit here on saving on insurance policies.
It's a good question. It's interesting because people mention liability in two different ways. One, they say, how can you promise an outcome? And I'm constantly say, well, we're not promising an outcome. We're actually increasing the chances that the outcome is what the patient wants, because now they have a viable or visual expectation. From the surgeon's perspective, I don't believe they do have an insurance policy in place where this would have an impact. I know when they have to reoperate, they usually, they're calling in favors. They're asking their anesthesiologist to help out for free, their nurse to help out for free. They're begging their implant company to give them a free set of implants to use, and then they're giving up their own time.
Yeah.
It's really a costly issue for the surgeon. I don't know if they have insurance for that.
Yeah. Wow, that's a lot of favors, because, I mean, as you said, 20% secondary surgeries are being asked here. So that's a lot of favors.
It's a lot of favors. And don't forget, I mean, what else happens in social media? One bad Yelp review is horribly damaging, right? And I mean, that patient's not referring any new patients. You have no referrals on new patients. Possibly, a patient that's going to write a bad review, which is going to be detrimental. And you're calling in all these favors. So it's really an issue. And by the way, there's another component to not really understanding what the patient wants. It's not uncommon for a surgeon to walk into an operating room with 5 or 6 boxes of implants, not knowing exactly which one they're going to use until the patient, is sort of already, is cut open and they're testing it out. That's an inventory nightmare for the implant companies. Buying 5 or 6 pairs, sending back 4 or 5 of them. So anything that helps the surgeon to understand exactly what the patient wants and pinpoint which implant that is another benefit to the surgeon and to the implant companies.
What made you decide to go the crowdfunding route for this?
Great question, Vin. I don't have a real easy answer for you other than it was a natural progression based on recommendations from my other investors. One person suggested it. It led to one discussion, which led to another discussion, and the more we learned, the more it seemed like it is a natural fit, right? There's not a lot of education that we have to make to get someone to be interested in technology used for breast augmentation. So that one seemed that made it clear. When I started working with Equifund, who's hosting us, the discussions with their founder, Jordan, made it seem much more clear that this was a good fit. And he seemed to really know all the, everything that needed to be understood about raising a crowd fund, not just the technical part of hosting, but getting all of the SEC components done, referring me to the right attorney to doing it, all of it. Understanding the marketing perspective of if you build it, you still have to attract eyeballs and give people a good reason to do it and be incredibly transparent with all of it. He guided me with such confidence that it wasn't a difficult decision. But mostly, again, based on those around me, not based on me.
So I'm just curious, how much time do you spend, let's say on a daily basis, crowdfunding? What percentage of your day is devoted to that activity?
Not a lot. It's really based on those who are going to the crowdfund and asking questions. I'm not doing the marketing. I'm letting Equifund do that. I respond to questions when they appear. I'll do webinars such as this one, but there isn't a lot of heavy lifting. Now, with that said, that's once it's going. To get it going does require a lot, and mostly because, as you all know, it's regulated by the SEC, excuse me, and that is they create a long, exhaustive laundry list of what needs to be put out there. So whenever anybody watching this is looking at our portfolio online, I mean, that information wasn't easy to, it wasn't sitting in one file folder and I handed it over and they digitized it and boom, the crowdfund's live. Right, that was exhaustive.
Yeah. If you raised the 1.07 million, what kind of runway does that give you?
The best answer is it takes us into total profitability. So we anticipate profitability on a thin staff within 3 months with that money in the bank. It depends how quickly we scale. I imagine that there's a chance we may not have to raise again. So there's no further dilution, though we may say it's better to raise again because we can build a bigger business, which is a bigger pie. So it's going to be a nice, ask me in 6 months or a year. I think it's going to be our decision to make. So it's not a question of that's going to give us money for 12 months, then we have to go out and raise again. I don't think there's a situation where we have to raise again. It's an elective question. Is it in the company and the investor's best interest for us to raise again?
Yeah. So I think a good question to kind of wrap this up is, what does success look like for Illusio in 2 to 3 years from now?
Crossing that 10% penetration barrier, and probably be on the natural by the end of 2020, we will be selling our licenses in, I'm counting off contracts that we already are working with, 6 or 7 countries already by the end of this year. So in 2 or 3 years, I imagine, sales in 15 to 20 countries or territories really profitable, looking at what other surgeries we can get involved with, certainly having a response to reconstructive surgery. And again, I just, from a personal perspective, that just means a lot to me. I want to go there. I want women who get diagnosed with mastectomy, that they have to have their breast removed, to have a 5-minute visual representation of the end of the tunnel.
And as you think about exits and, for investors, how do you think about that? Is that an acquisition? Is that just you're a profitable company and you eventually IPO? How do you kind of think about it?
I think that I don't want to I don't want to answer that now. I want to get to that point where that's a great discussion to have, right? Let's look at we now have the possibility to go public. We have the possibility to be acquired. We have the possibility to keep growing and to enter into new markets, to increase our TAM, like that one viewer recognized. I just look forward to having those discussions. I don't know yet. I think there are possibilities for all of them. Clearly, an acquisition, probably to most people, makes sense in 3 to 5 years. By someone like J&J, that seems to would be an obvious, answer. But maybe it's not that. Maybe it's a spinoff. Maybe they acquire exclusivity for anything dealing with breast implants, and we can continue to grow the business outside of that. So a lot of different possibilities.
All right, I think that's a good place to end things on. Ethan, thank you so much for joining us. Thanks everyone for attending the webinar. You can, of course, invest in Illusio at equifund.com, and you can also read more about it. You can read Andy's recommendation at earlyinvesting.com, and you can see how Kingscrowd rated Illusio at kingscrowd.com. Thanks for watching, everyone.
Excellent.
Thank you,
Thank you so much.
Thank you
Take
for
care
joining
now.
us today.
Bye.
We'll see you.